Good morning. It's Julianne Nichols, CEO of Focus on You Strategy, and we have a special segment of Focus Fridays. In this segment, we're going to be talking to Thomas Rothway. He's a licensed massage therapist and physical therapist, and has worked in both spa and medical settings, and his experience is focused on orthopedic and injury rehabilitation. And he's also worked in hospitals, skilled nursing, and home health environments. And he has a passion to deliver therapy that results in measurable improvements. And his goal is to provide patients newfound relief from pain. Welcome to the studio.
Perfect. Thank you, Julie.
How are you,
Pleasure to be
Thomas?
here. Wonderful.
So tell us a little bit more about your, is it Massage and Wellness Spa, right? In
Yes.
Largo, Florida.
Right in Largo, beautiful downtown Largo. Always under construction, Largo. They're improving. Mm-hmm. So I've actually been there as long as I've been doing massage therapy, and I got into massage therapy back in 2007. So it's been
Almost 10
quite
years.
a while, coming up on a decade.
Yeah, that's awesome.
And I guess the way I found wellness and particularly massage was looking for a career change. I was growing up and realizing I was growing old. I'd already been through several careers. As a teenager, I was into automobiles, so I used to customize cars and trucks, and always an entrepreneur. I was in a family business back then and really enjoyed doing that. And then for a while, I dabbled in real estate. And that was something completely different again, but I felt like appropriate at that age.
Yeah.
And then I realized, there's a lot to be recognized with what we can do to take care of ourselves. So at that point, I thought I've fixed cars, I've fixed houses, now I want to fix people.
Nice
And,
segue. I love that.
I felt massage was an easy and reasonable way for me to get to school and do something in a short amount of time and see if it was a helpful thing for the goals I had and the way I wanted to help individuals.
So over the past 10 years, you have found there a lot of different trends going on and observations of those trends in holistic healthcare and wellness. Tell us a little bit more about that.
Definitely. I feel like the public's just become more educated. People are much more active in being an advocate for their own health. They're much more aware of the options that are out there. And they're realizing their potential to live longer is there. The quality of life that they're going to live is up to them. Mm-hmm. And that's where we try and provide really a unique environment in that we give good guidance. The resources we don't have, we're not afraid to help people find other resources. I'm very much an entrepreneur, but I'm also a believer that co-branding and cooperative efforts amongst professionals is the best way to go.
We call that co-opetition at Focus.
I like it.
Yes.
And I'm glad to be here with JD. I mean, we've got some overlap, and there's some wonderful things that we share about the way we're helping people. And that's kind of the relationship I'm talking about. Mm-hmm. I work with other professionals, both massage therapists. I have estheticians that work with me at Massage and Wellness Spa. Mm-hmm. And those experts are skincare, waxing, their own niche.
So it's a full-run spa. It's a lot of
Absolutely.
services involved there.
Yep.
That's great.
And also we recently, 2016 actually, I have some business partners I work with that we started West Bay Therapy. And West Bay Therapy initially was going to be auto accident treatment, but really overlaps well with the massage and wellness and kind of that health coaching basis that people needed, and we recognize that need. So now we're doing both the auto accident treatment and some health coaching to complement the massage, and people who are on the path with other businesses like JD. They just need a good baseline, and we help with that.
Mm-hmm.
I've been in a few car accidents, and I was never aware that there was a specialty in massage for people that have been in car accidents. Is this something that's new or something that you came up with yourself?
The use of massage with the treatment of car accidents is just a component, and we're using that to manually improve the quality of tissue as it's healing. We have to supplement that with other treatments. The physical therapy component of that business makes it unique. It's a comparative treatment to chiropractic, for example. We're trying to really bring them on a path to wellness. And then with the massage part, people can do that, whether it's like a spa day or if it's a piece of a treatment for an auto accident. Either way, it's going to be therapeutic and helpful.
So what are some of the differences between, say, general massage and what you do?
General massage, to me, is really a personal choice, whether someone's wanting to relax, whether they need therapeutic. We focus a lot on 3 areas, pain management and posture improvement, but also we try and help people with the progression of their exercises when we're dealing with a healthy plan. And I think that's probably what makes us unique, is we approach each person as an individual, and we know what resources to match them up with, whether it's an auto accident or if it's just they want to stay well or recover from some chronic pain.
Yeah, that's something I definitely could have used. I had a major back surgery where I had a laminectomy and a fusion.
Oh boy.
And then as soon as I think I was able to walk 3 months later, and I was going through PT and all that, but it was like basic generic PT, you know what I mean? So if I'd have found something specialized, I think I'd have been better off. And then I got into a car accident on a Monday. I got rear-ended by this lady. A week later, rear-ended again. They sent me right back to physical therapy, but I went to a basic physical therapist, and I just felt like I didn't get anywhere. It was the same routine: stretch, do this, and you do it for 3 weeks or something, and then the doctor's like, "You're all right," and they send you on your way. Yeah. But the pain was still there. Do you come across this a lot? And is the specialty massage therapy for people in car accidents becoming more prominent because of people like me not getting anywhere with their basic treatment?
Yeah, I think you're right on both counts. It goes back to kind of the one-on-one treatment that we like to provide, and the circumstances around every auto accident are different. In addition to that, every person's prior health condition's different. So we want to look at what they've been through already, how this has affected their current health picture, and then we adapt that accordingly. And it does make a difference having physical therapy versus just having, physical therapy for auto accident versus just having physical therapy, because it's a pretty specific type of injury in most cases. Mm-hmm. And we have not only what's going to be provided for you by your auto insurance, but we also have what's going to be covered through, other options that are not covered by insurance.
I don't know how I pulled that question off. I'm going off an hour and a half of sleep.
Doing good.
So you also have a specialized massage therapy technique you developed. It's called the World Fusion Massage,
Yes.
which includes an exclusive blended style of massage based on Thai massage and physical therapy type movements. Can you tell us a little bit more about that?
Love it. Yes. It's our sampler.
Your sampler.
Service. Yeah. It's like if you go to a restaurant and you order the sampler, you want to try a little of everything. Right. We love people to come in and try that massage.
That sounds very intriguing. So tell me, what is that about?
It's traditional massage technique. So a lot of the soft tissue work that people are expecting, but we introduce modalities from around the world, which is how it gets its name. We use warm stones, bamboo, which are tools used by the therapists, slightly warmed so that they soften the tissue even more. And then we incorporate some stretching, and we use other modalities, extra work on the hands and feet and scalp, which are also helpful. Mm-hmm. And it comes together beautifully. People like it. It's a very relaxing.
Is it something you offer every new patient to kind of pinpoint what treatment they need?
That is a specialty massage they can choose. In almost every case, there's an excellent intake for every new client, which is going to customize the treatment you get, whether it's massage or if you're coming in for physical therapy, it's a formal evaluation. We do that and then customize it accordingly.
So do you ever have people that come in and say, I've never done a massage before, I don't even know where to begin? What would you recommend? Yeah, it's like some people are like, I don't know if I can have somebody touch me. So what would you recommend if somebody came in and wanted to get a massage for the first time?
I would recommend, if they have preliminary questions, try and visit our website and explore that first.
And your website is?
It's www.massageandwellness, all spelled out, massageandwellness.com. And there they can explore kind of their first visit options. There's testimonials about people, which is oftentimes comforting or encouraging. And then they can even get to meet their therapist. I mean, we have 15 practitioners we work with in the group already. They're the massage therapists, estheticians. We even have relationships with acupuncture, the physical therapy at West Bay Therapy. That helps people figure out where they need to begin sometimes, and they can call us or just stop in. We'd love to give you a tour of both the therapy gym and the massage side, that's a great place.
So similar to
start.
what JD was talking about, you have a great team of people that they
Makes
can
a
go to.
difference.
So it's not all just you. It's a great team of people
That's
that work
right.
together to make you healthy.
Yes,
Correct?
it takes a team.
Yeah. So, and they can find you at 118 West Bay Drive in Largo, Florida. And that's West Bay Therapy, correct? And
Correct.
then they can also find the massage and wellness spa at that same location,
Same
correct?
location next door to each
So
other.
if you've been in a car accident and you want to get a massage and then you want to go to the spa afterwards, right? You can do it all in one
you can
place.
do it in one stop.
That sounds great. So tell me a little bit more about this World Fusion massage that you do. So if I had been in an accident and I wanted to like start this World Fusion massage, is it something that is possible to do, or are you going to recommend that I stick with the therapy first before I go to something like that?
In most cases, we're dealing with two different incidents, two different needs, as we discussed. So when someone comes in and we identify they've been in a car accident, a lot of times the first thing we need to do is make sure that they're set up for their plan of care. And most times that means they'll be using their auto insurance. And by the way, that's the only insurance we take. And that's an important thing for people to understand. You're dealing with two businesses. You're dealing with two options. You can cash pay on one side, use auto insurance on the other. And that type of incident is going to call for a very
So spa is
gradual,
no insurance and therapy is insurance.
You got it. And
Okay.
auto insurance only because it's specialized in that treatment. But they can expect that they'll get that World Fusion massage if they want to use that opportunity before a car accident or after they've recovered. They're certainly able to enjoy that too. But it's kind of a fork in the road when they come to us, tell us what their needs are, and we're going to make sure that they're directed in the right way.
We're talking to Thomas Rosway, owner and practitioner with Massage and Wellness and licensed massage therapist and physical therapy. And when we come back, we're going to talk a little bit more about how we can get those great massages and feel better. Julianne Nichols, CEO of Focus on You Strategy. And in the second half, we're here talking with Thomas Rosway, the owner and practitioner for Massage and Wellness in Largo, Florida. Welcome back, Thomas.
Thank you.
So you've mentioned that you've had some personal exploration of wellness, and you want to talk a little bit more about your wife's situation.
I do. I had already been in wellness for a few years when I met my beautiful wife, Pepe.
Where's Pepe from?
Pepe is actually from South Carolina.
You would think with that name that, you wouldn't think South Carolina.
Not at first. And when you see her, because she's also got Asian in her family from her mom's side, it definitely catches you off guard. Beautiful Asian face, but a Southern accent. So that captured me right away.
Oh,
I actually
bet.
had a friend in North Carolina that was like that. It was pretty neat.
Yeah.
you're
Yeah,
very
her name
unique.
wasn't Pepe though.
No.
That's a beautiful
I
name.
think it was Jennifer.
I guess that probably is the translation. Pepe is very common over there, so it probably is Jennifer.
That's funny.
So we met in 2011, actually on Match.com. So welcome to the new generation of dating.
Yes. And it was successful.
Beautiful and very successful experience on Match.com. And when I met Pepe, fell in love, and very shortly into our relationship realized we had a lot in common with wellness. And we both are passionate about it. She's actually in the field of therapy as well. She does therapy and deals with lymphatic drainage in patients who have lymphatic issues, sometimes some cancer treatment, sometimes some diabetes. Just another extension of treatment. And in fact, that's something we do offer as well, is lymphatic therapy at our wellness center. But the irony in the story I'll share with you is a personal one. Just a few years after we were married, Pepe was diagnosed with breast cancer.
Oh, I'm sorry.
And it was life-changing for us both, but in a positive way. 17 months of treatment, chemotherapy, and the entire journey really was an inward seeking experience about how wellness really translates into well-being and what we have control of that we take for granted maybe early on, and that by the time you're in that reality and examining your mortality, you really you want to rewind the clock, or you think, what if? So we went through that, and I just want to share that with people that don't wait for that moment in your life, whether it's that you're dealing with chronic pain or that you've overcome some disease or a weight issue. Come to us now. Let us help you get on that right track so that you feel like you're doing the best you can. And we'd love to be a part of your healthcare team.
Yeah. You also have some giveaways you're giving away on your website,
Yes,
right?
we are.
So they can go to massageandwellness.com, and that's all spelled out, massageandwellness.com.
You got it.
And you have 4 giveaways. You have a free chair massage for an office event. You have free massage and facial spa day package, and a free FMS screening and health coach consult. What is an FMS?
Functional movement screening.
Nice. And a free waxing service.
Yes.
So you got
So
some extra
something
hair
from
you
every
want to get rid
department.
of, right? You want to get over there. So you have a chance to enter those contests, and you're going to give those away at www.massageandwellness.com. So we were also talking about the fact that you don't just deal with auto accidents, right?
Correct.
There are people who actually have different types of accidents, maybe just leaning over, picking up something, and they have bulging discs. So how do you help people like that?
Let's talk about it. The difference with that patient is they're probably after some sort of recovery time. So they're coming to us maybe 5 years later, and this problem still exists. It's still bothering
They
them.
don't want to have surgery. They don't want to get
wanna
cut
have
open.
surgery, or they've had unsuccessful surgery.
At that too,
You
right?
know, we've seen a lot of cases where people are just dealing with a lifetime of symptoms and pain management.
Harumph.
Yeah.
So
And,
how do you help them with that?
I think a lot of times we begin with that assessment component we talked about, and it can be done with some physical therapy influence, but we bring it back to the fact they may not have insurance. This isn't something covered by insurance, but if we can provide them with that same expertise and give them a reasonable path to pay for it through cash pay programs, now we've got a plan where maybe we're teaching them some basic home exercises. We can do that functional movement screening that we talked about. And really assess where there is weakness, where there is tightness, and formulate a plan so that they can do some things on their own. If there's someone who's working with a personal trainer like JD, now we've got a baseline and we've got some real fundamental assessments to work from. That, along with the massage, where we're reconditioning the tissue, helping it heal, breaking up scar tissue.
Yeah, that's important.
I mean, these are the ingredients it takes. The body is such a complex machine we take for granted. If you look at it from an engineering perspective, we can really do repairs on it as good as we can fix a car. And, you know, the reality is people spend more time fixing their car than they do their body.
That is
And
something.
you can't trade this one in.
Right. So the key here is when you have back problems like that, the key is to get up and move around more, not be sedentary. Is that
In
correct?
a lot of cases, that's true. And knowing what not to do and knowing what you should do.
No more bending over, lifting. Make sure you use your knees. All those standard that they tell you to do. Right.
Yes.
So, what do you think is the biggest hurdle for people like that to come? Understand money can be it, because if insurance doesn't cover it, it's a cost, a weekly cost. So, how often do you think they need to set aside to come and see you so that they get effective treatment that will help their pain management?
Good question. In the beginning, it's going to depend on what we discover in the assessment. It might be that they have to come in a little more frequently, a week or 10 days apart, for example. It may be that as time goes on, we start to get numbers that are measurable, like their pain level. If their pain level was a 9 when they first came in and we can get it down to a 7, then we can adjust the time and see, can we keep it at 7 or below? So we're using measurable goals and assessments to move them through their treatment. And ultimately, we hope that it can be something maybe once a month they can budget for, just the same as you would get an oil change on your car. Since
Right.
we use that analogy, what is your schedule for taking care of your well-being and ensuring your health before it's too late?
Well, and how much longer do you really want to stay in this type of pain and
You'd be surprised.
Keep
a lot
going.
of people don't move for years.
Yeah. And when we talked about moving or not moving, that happens. They get hurt and they think, well, the best thing for me is to do nothing.
Thank you so much, Thomas Rossway, owner and practitioner of Massage and Wellness, for being with us today.
Thanks for having me.
And thank you, Jamie, again, for letting me to guest host Focus Fridays. You can find out more about Focus on You Strategy at www.focusonustrategy.com. Thank you, and we'll see you next Friday. you.